Well, right turn alert. With COVID cases rising once again, they're being fueled, as we've been talking about for several weeks now, by the BA.5 Omicron subvariant.
In many places, it looks like the pandemic is over, but health officials are warning people not to let your guard down.
UW Health's Dr. Jeff Pothof is back with us for his weekly visit. Good to see you again, Dr. Pothof.
How you doing? You guys. I'm doing great.
No, you know, it really is true that it seems like the pandemic is over, and yet cases are going up. Hospitalizations and deaths are all going up. And help us process this a little bit, because I think when we first got our first vaccine, we thought, you know, we could exhale a little bit.
Yeah.
And then we had to get another one and a booster and then a second booster. So I think it's causing a little bit of fatigue and maybe even some frustration about where we are right now. How would you explain that?
I think that's fair. I think, you know, on one hand, when those vaccines first came out, we were all really excited because we thought there would be this, you know, wide adoption of this vaccine. Lots of people would have immunity and we could kind of stop COVID with just those original strains. But that didn't really play out. So we started having these variants and these variants got better and better at defeating our vaccines in the sense that people are getting symptoms. They've done pretty well as far as, you know, preventing severe disease, and now we're seeing, you know, additional, you know, surges of BA.5, the subvariant of Omicron. But I think things are very different. You know, before, when we would have surges, they would be followed by this predictable, pretty steep rise in hospitalizations and a pretty steep rise in deaths. And this time, we're certainly seeing the cases increase, and some increase in hospitalizations, some increase in deaths, but at a much lower rate than we've seen in other parts of the pandemic. So even though it's like, oh my gosh, how more times are we going to have this happen? Every time it happens, it's a little bit better. And I do think we will get to the point where we won't see these subvariants develop quite so quickly. We can get onto a more regular schedule of maybe we get a booster once a year and we're fairly well protected, and not every 6 weeks talking about, you know, the next variant that's kind of causing problems.
Yeah. So now we're talking about monkeypox. If you don't have, you know, COVID, you're talking about monkeypox. Did this country start a little bit too late?
You know, I think
in tackling this?
When monkeypox first started, I think there was kind of this idea that it'd be pretty easy to get on top of it. It's not nearly as transmissible. It's, you know, initially spreading in pretty close social networks. But now, you know, as we see more cases both in the United States but also around the world, I think there is some concern that, you know, this might be something that isn't just going to go away without a little extra help. And I think that's why you're seeing more resources devoted to this, and this idea of, you know, creating increased awareness, who's getting it, how you protect yourself, and then talks about vaccination, which thankfully we have vaccines for monkeypox, but thinking about, you know, who needs those now, those highest risk, and will there be a time where more of us are getting vaccinated against monkeypox?
Speaking of vaccines, we've learned a lot over the course of this pandemic, and as we sit here today, there's talk about a new vaccine coming in the fall, probably around October, I thought was the latest that I read. Is it possible to make a vaccine for all the variants, or will the one that's coming out this fall be targeted specifically to this BA.5 variant? And then are we going to be in the same boat we're in now, where you'll keep having to get them?
Yeah, so the vaccine that we'll see this fall will be bivalent or hybrid. So it'll have like the old vaccine, which does a nice job against protecting against severe disease. It'll have coverage for BA.4 and BA.5. Now, in a perfect world, BA.4 and BA.5 will still be the dominant variant when that vaccine's available, in which case we might see pretty good protection, maybe even protection against developing symptoms at all. But even if we move on from BA.4 and BA.5, it's likely that whatever subvariant comes next will be more similar to BA.4 and BA.5 than our original COVID vaccine. So it's not like all hope is lost if it moves on. That vaccine will still be probably more effective than what we're used to. But what we really need to get to is the development of variants at a slower rate than we're able to develop the vaccine boosters, so that we can actually match that vaccine specifically to the variant that's out there. If you tried to match it to every variant, it would be less effective against any one of them.
Okay, very interesting.
Well, thank you very much
to
for
be
being
continued.
here.
Thanks, Dr. Pothof. We'll see you next week.
Sure.